What's up guys, Dr. Golbek here, and today I want to talk a little bit about runner's knee. Now runner's knee is that annoying pain that we get right at the bottom of the kneecap. It's super common, super annoying, lots of people get it. It doesn't have to be a runner. Jumper's knee is another thing that people call it, but anybody can get it. And the issue with this is that people will tell you there's all kinds of different things that are causing it. We have tight quads, we have weak quads, we have hips that don't work, glutes that don't fire, core is not firing, all kinds of things like this. And the issue is that there can be a plethora of different causes. There's lots of different things that can cause this. However, there are 3 specific exercises that will typically at least calm it down that I like to give most people. So today what I want to do is go through these 3 exercises and show you what they are, why they work, and a few different ways that we can progress them or regress them if we need to. Now, if you're in enough pain or you're fearful of hurting yourself, then obviously that's an issue where you would come into the office and get a full assessment to make sure that you're safe to do these. And many times the treatment that I'm going to do is something that will help to open a window so that you can do these things that are going to fix yourself. So if you don't feel like you're ready for the movements yet, then obviously an assessment and treatment would be something that you need. But if you feel okay and you're ready to do this, this is something that may fix your knee pain before you ever have to come in. So let's go ahead and take a look. So my absolute favorite place to start a patient that has knee pain or that runner's knee or jumper's knee is with the dead mill. Now, this is something that I picked up from Ben Patrick, or Knees Over Toes guy if you've seen him on Instagram. Absolutely love this, and it helps with almost every knee patient that I have. So what you're gonna do is have a treadmill that's turned off. We're gonna start facing backwards, and we're just gonna work on pushing that treadmill while it's turned off. Now this is gonna get a huge quad pump for you. And what we wanna do with this is 2 minutes, and this is your warm up. Ben actually calls this reverse out knee pain because it works so well to take care of some of the pain we have and help to strengthen some things as well. So we're gonna do 2 minutes with this. Now, if you don't have a treadmill or access to a treadmill at home, something you can do is a sled, and you can walk backwards pulling the sled. If you don't have a sled, you can grab a sandbag or kettlebell, one of your kids, and you can just drag them. Obviously, make sure your kid's comfortable with that, but what we wanna do is just drag that backwards for about 300 meters to get everything warmed up. Next, we're gonna work on step downs. Now, I've been using these step downs for years, since back in the days when I was high jumping in Arkansas. This is another thing that Ben uses in his program, and I love the way they regress this. So, what we wanna do is make sure that there's no pain. We want 0 pain at all as you do these. Now, what you wanna do is go 1 leg at a time. You're gonna keep this leg straight as we come down, tap your heel, and then come back up. Now, one thing we wanna focus on with this is that our hips are not popping back like this. And you're gonna want to let the knee start to drift over the toes a little bit. Many people will tell you that the knee should never go over the toes when we squat. It's just not true. The knees are designed to do that. We just have to make sure that we build up our capacity to do it first. And so this is where we're gonna start. We're gonna use these little micro movements. So with this, you're gonna do sets of 10, just working on slow control, letting that knee dip forward on the way down and then exploding on the way back up. Now let's say this is too high. So we never really want to go any more than about 6 inches in depth. You can literally start from the floor. From here, we're just going to let that knee start to go over and then extend back out. Knee dip and back out. That's a starting point that we can do, and we can do a few sets of 10 of these, making sure we're not feeling any pain on either side as we do these. And last, we're gonna do one of my favorite exercises for building robust quads and strong knees. So what you're gonna do is start in this position on your knees. If you need a pad or something, that's totally fine if your knees are uncomfortable sitting like this. Now in this position, we wanna make sure we squeeze our glutes the whole time because I want you to keep a straight line with your body so we don't pop the hips back as we do this. Now, if we get to a point that you feel uncomfortable, like you're gonna hurt yourself, letting the hips pop back is a way that you can take the pressure off the quads, so that's fine. But when you're actually doing your working sets, we don't necessarily want to do that. So from this position, we're going to keep our glutes squeezed the whole time. You're going to slowly control as far back as you can. Now, if you're crazy, you can work your way all the way back to here and then control back up. However, starting, you don't necessarily want to do that. These should feel good and there should be no pain at all. So if you're literally moving this much and then back forward, that's totally fine for the beginning because we're working on building our capacity. We're not working on going past that and hurting ourselves. Now, the best case scenario, what I want is a 5-second count. 1, 2, 3, 4, 5, and then come back to the starting position. Now, these are and can be pretty aggressive. So We really only want to do sets of 5, maybe 10 at the most. Typically starting with 5 is going to be plenty, and we'll do about 3 sets. So what we want is no pain. We want to go back to a position that you feel comfortable coming out of, and then you want to come back to the starting position, and we'll repeat that about 5 to 10 times. So if you're trying these out, go ahead and start with the regressed version. Start with little tiny movements and work your way into these big movements that are going to help a lot. A lot of people, when they have injury, they become fearful of the movement. We see fear avoidance all the time, and really if we can just get them comfortable doing pain-free movements and then building their way into strong movements, it's going to fix their issue. But we have to take that first step first. So go ahead and try these regressed versions and start to build your way up, because if you can fix yourself, you should. And if you can't, we're here.